If you can't sneeze, laugh, or cough without leaking a little urine, you're not alone. Problems with the pelvic floor are common and can happen to anyone. Yes, anyone, men or women. The pelvic floor can be the cause of lower back pain, and it also plays an important role in sexual health. Learn some important tips to improve your pelvic floor health.
Learning how to properly breathe and contract even the pelvic floor, it's essential for everyone's greater health. The pelvic floor is the bottom of your core. It's where it holds a majority of all your organs and intestines. Normally, when people think about the pelvic floor, they'll immediately think about Kegels.
Kegel exercises are a series of contractions and relaxations of the pelvic floor muscles, the same muscles you use when holding in urine.
A lot of the times when we find people trying to engage in a Kegel exercise, they're really just squeezing their glutes and not really squeezing the pelvic floor.
Strengthening the pelvic floor helps support the bladder, bowels, and uterus, can help with bladder and bowel control, can reduce lower back pain and pelvic pressure, can lead to improved sexual function and sensation.
The first thing that I always have to educate is nasal and diaphragmatic breathing. Nasal and diaphragmatic. The majority of people don't think about the way they breathe, and the majority of people are mouth breathers.
Breathing through your nose is more beneficial than mouth breathing, since your nose helps filter out dust and allergens. Nose breathing also increases airflow to your arteries, veins, and nerves. Diaphragmatic breathing involves taking slow, deep breaths using the diaphragm and abdominal muscles. Breathing like this stretches your pelvic floor on inhale and contracts your pelvic floor on exhale, keeping your pelvic floor strong and flexible.
Again, if I'm just breathing from the belly all day, I'm not expanding the back of my ribs at all, and I'm not really expanding my lungs.
Posture is also very important.
For strength training, the pelvic floor is so important to learn how to brace the bottom half of your core. A lot of people have this extended or arched position and have a lack or it's called hypertensive pelvic floor because of our rounded posture or because we sit all day. It is hypertense. It is hyper tight. I'll give you one exercise that everyone should integrate. It's including the whole spine, but really focusing on the pelvic floor. With hands extended, you're gonna inhale wide through the ribs. And then you're gonna exhale, squeeze your knees together, lift your feet, and arch your back. Inhale. Exhale, feet up, knees together, arch your back.
Squats, lunges, and yoga poses such as Happy Baby, the static squat, and the chair pose can strengthen your pelvic floor. Remember to focus on form and engage the muscles each time you exercise.
You would notice a difference in the exercise in a matter of 1 to 2 reps if you're relaxing, inhaling bigger, embracing harder. You will feel stronger in that rep.
If you are experiencing frequent problems with bladder and bowel function, or have pain in the pelvic region, genitals, or rectum, make an appointment with your healthcare provider right away. Visit vivaresourcecenter.com for more tips about healthy lifestyle changes to improve your overall well-being.